right, Marvin, thanks for coming to meet with me today. As you know, we met a couple of weeks ago. We had a little initial interview, went over some things, did some measurements together. So I have the results from those tests that we went over. So the main ones that are going to be focusing on today are going to be the measurements of BMI and waist circumference. So for BMI, we were able to calculate for yourself using your height and weight that your BMI is 28.4, which does fall into the technically overweight category as a client. Not a huge concern to be concerned with. Obviously, it's a little bit alarming, something that we are going to be taking note of, but it's not a huge concern. And then for waist circumference, we measured in on 101 centimeters, which again also is technically in the overweight category. It's considered an increased risk. So again, something that we will be taking into account, but again, not a major thing to be super concerned about, given the fact that you're not overly active and you don't do a ton of regular physical exercise. It's actually pretty good, because the next category up would be the obese category, which obviously we don't want to fall into that category. So being an overweight, considering your lifestyle and what you do currently, is probably best case scenario right now. So there's going to be a couple of tools that we're going to work through here together. I've got them both here with me. We're just going to work through. It's just going to be mostly a bunch of question answering on your part and me going through and taking a look at the results for those. So the first one we're going to go through, I'll show you here, it's called the Get Active questionnaire. This is basically, you can think of it almost as like a little mini health screening, basically is what it's going to be. It's going to be a bunch of health-related questions just based on your past, any experiences that you've had, and it'll see then if I need to refer you to a licensed physician in order to get you extensively cleared to participate in your physical activity.
Okay, sounds good.
So, first question I'll ask you, and these are all going to be yes or no questions, and these are all within the past 6 months as far as a time period. So again, just answer yes or no for all of them. Have you experienced a diagnosis or treatment for heart disease or stroke or pain, discomfort, pressure in your chest during activities of daily living or during physical activity?
No.
Okay. Have you experienced a diagnosis of treatment for high blood pressure or resting blood pressure of 160 over 90 or higher?
No.
Okay, perfect. Have you experienced dizziness or lightheadedness during any physical activity?
No.
Okay. Have you experienced any shortness of breath at rest?
No.
Okay. Do you experience any loss of consciousness or fainting for any reason?
No.
All right. Any concussions for any reason?
No.
All right. So the next one here, these are going to be a little bit more extensive as far as the wording. So, do you currently have any pain or swelling in any part of your body that affects your ability to be physically active?
No.
Okay. Has the healthcare provider told you that you should avoid or modify any certain types of physical activity?
No.
Okay. Do you have any other medical or physical conditions such as diabetes, cancer, osteoporosis, asthma, or spinal cord injuries that may affect your ability to be physically active?
No.
Okay. Perfect. So we'll flip over to the next one. This next one here is going to be a little bit of an analyzation of your current physical activity level, taking a look at what you currently do and seeing where we can improve on that. So these ones here are going to be a number-based question, so I'll go ahead and get you to give me a number. During a typical week, on how many days do you do moderate to vigorous, intense aerobic physical activity? So this can include brisk walking, cycling, jogging, anything along those lines. Taking the dogs for a walk, something like that. How many minutes would you say on average in a week?
Minutes or how many days per week?
How many days per week, yes?
1 to 3.
1 to 3, okay. And on the days that you are participating in those, for how long would you say that that's lasting for? So on those 1 to 3 days, how long per day would you say?
30 minutes.
30 minutes, okay. Perfect. Okay, and then I'll go ahead and I'll take care of the next one myself. So then what we'll get you to do at the end here, once we've gone through everything, is I'll just have you sign off at the end of this on the bottom, but we'll go through that at the end.
Sure.
All right, so next one we're going to go through, I'll show you here. It's called the Physical Activity and Sedentary Behavior Questionnaire. This here is just a questionnaire about your current daily living, some of the activities that you partake in, what you're currently up to. So we'll go through, maybe have a little bit of a discussion with some of these as we're going through here.
Okay.
So first category is aerobic physical activity. So first one is frequency. Kind of answered this, but we'll go through it again just for logistics sakes. In a typical week, how many days do you do moderate intensity to vigorous intensity aerobic physical activity? So we said 1 to 3, so we've already answered that. Time or duration, on average for those days, how long you're participating in. So again, we said 30 minutes before, so I'll do the same thing, so I'll toss that on there. So then the final one is multiply your average number of days per week by the number of minutes per day. So that'd be about roughly 90 best case scenario. So we'll say 30 to 90 for that one. All right, so next category is going to be muscle strengthening physical activity. In a typical week, how many times do you do muscle strengthening activity? Now this can include resistance training, gardening, if you're doing any moving things around the house, lifting any type of boxes or anything. How often would you say you're doing that per week?
0 to 2.
0 to 2. And what would those activities be for you, would you say?
Just regular household duties.
Household duties?
Taking the garbage out. Shoveling snow.
Okay. Any gardening included in there in the summertime?
In the summertime, yes.
Summertime, okay. Anything included of that category from your job? Or nothing?
No,
really?
my job is sedentary.
Job sedentary, okay. So next one's going to be a ranking scale. It's going to be for perceived aerobic fitness. So the category is going to be excellent, very good, good, fair, and poor. So you're going to pick which one you feel you fall into. So in general, would you say that your aerobic fitness ability to walk or run distances would fall under which category? So again, the categories are excellent, very good, good, fair, and poor.
Fair.
Fair? Okay. Do you do any kind of walking or running right now currently, or
I take the dogs for a walk.
take the dogs for a walk? Okay, perfect. So that would be your 1 to 3 days per week, you'd say, of vigorous to intense walking?
Yes.
Okay, perfect. So the next one here is going to be sedentary behavior. You mentioned that your job is sedentary, so this will come more into play for you here. We're just going to kind of analyze and see what you're doing during that sedentary time and how long you're in that for. So on a typical day, how many hours do you spend in continuous sitting? This would be at work, in meetings, volunteering commitments, or commute to and from the office. So we've got none, less than 1 hour, 1 to 2 hours, 2 to 3, 3 to 4, 4 to 5, 5 to 6, or 6 plus. This is per day again.
6 plus.
6 plus per day. You're in an office for your job,
Yes.
I'm assuming then? Okay. Sitting in front of a computer for most of the day?
That's great.
Okay. So next one here, this will kind of tie into that. On a typical day, how many hours do you watch television, use a computer, read, or spend sitting time quietly during your leisure? Probably 6 plus again?
Like including my job? or
Including your
outside?
job.
Yeah.
Okay. Do you do anything else that would fall into that category when you come home? Any TV, any book reading?
Driving would be another hour, 30 minutes each way to work, and then 2 to 3 hours watching TV.
Any book reading included in that, or not overly?
Not really.
Okay. So then I'll go ahead and I'll film loss myself. So next one's going to be when sitting for prolonged periods, so 1 hour or more being the prolonged period. At one interval, would you typically take a break to stand and move around for a couple minutes? So we got less than 10 minutes, 10 to 20, 20 to 30, 30 to 45, 45 to an hour, hour to 2 hours, or 2 hours plus.
Probably 45 to an hour.
45 to an hour? Okay, perfect. And what do you do during those times? Is it just like bathroom breaks, get up and go get something?
Yeah, washroom break, or go to another part of the office to check with one of my colleagues, talk to them,
Okay.
talk to my director.
Okay, perfect. Okay, perfect. Okay, so this is good info to have here. Again, obviously, like I mentioned, you are falling into the overweight category, like I mentioned, and obviously it is something to a sign to be concerned about, but it's not overly concerning given that we're not falling into the obese category. So this is something that can be easily corrected with a regular exercise routine. You mentioned you sit in a sedentary job and then you come home and you basically watch TV when you come home. So that's totally normal if you're not taking part in any kind of regular physical activity. Obviously, especially at your age with the metabolism being slowed down, you are going to fall into that overweight category. So nothing that a regular exercise routine can't correct there. So our next step will be going through and doing a few more assessments to kind of see where you are right now as far as your fitness level, and then that'll help me into designing a program for you to use going forward.
Okay, that sounds good.
Okay.
Thank you.
Well, thanks for coming to meet with me
Thank
today,
you.
Marvin. Look forward to talking to you again.
All right.